Hello, Facebook and YouTube. Dan English here. I'm your friend in science communication and hopefully science policy here sometimes here. This is another one of our Friday roundtables for the local science engagement network. Today, we're going to be talking about COVID-19 vaccines in Missouri and vaccine equity and access for everyone in Missouri. We talked about COVID-19 vaccines in Missouri back in January, and we talked more about the science behind them. So if you want to know more about the science behind them, I suggest go back and check out the video of that. If you have any questions for our panelists today, there's the comment section down below. Make sure you type in your question for them, and we'll get to it. Sometimes the questions don't hit our eyes until a couple minutes after you write them. That's okay. We'll get to your questions. But without further ado, let's rock and roll. Let's introduce today's host, Dr. Josh Bratbird and Dr. Jenny Mueller from the Most Policy Initiative today. Doctors, how are you doing?
Great. We've taken each other's last names, I guess.
This is really a cooperative effort, Jenny here.
Yeah. So do you want to lead off and give an introduction?
Yeah, let's kick it off. I wanted to start by giving just a brief introduction to context in which we're having this discussion. Like Dan mentioned, we talked a little bit about vaccine equity back in January, and maybe Dan can share that link at some point. But I just want to contextualize where we are now in the current COVID-19 pandemic. Turn it over to Jenny, and then we will introduce our all-star slate of speakers today. So to date, the state of Missouri has had now over 500,000 documented cases of COVID-19 and over 8,000 deaths. So that kind of underscores the seriousness of this event. And we know people have been affected all across the state. Shown here, we've got a graphic that is on the left showing you kind of the current trend in COVID cases, color indicating where those cases are located. Overall, the numbers are they're trending in the right direction. They're looking more encouraging. A total of about 300 to 500 new cases confirmed per day, and down to something like 2 deaths related to COVID-19 per day. So these are numbers that we haven't seen this low since about March or April of last year, before we had a really big summer surge. So one contributing factor for sure to this trend is that now over 2 million people in Missouri have had at least one dose of COVID-19 vaccination against COVID-19. So that's something like 37% of the state, growing every day with about 30,000 vaccinations happening per day. I will note that number was closer to 40 or 50,000 a few weeks ago. So maybe that's a trend we'll talk about during the panel a little bit today. As a reminder, there are currently 3 vaccines available in Missouri: Pfizer, Moderna, Johnson & Johnson. The 2 Pfizer and Moderna vaccines, 2-dose requirement, Johnson & Johnson 1. But all 3 have proven really, really effective at preventing serious illness and hospitalization and death. So Jenny, can you tell us maybe a little bit more about some of the trends we should be paying attention to, and then kick off our panel here?
Sure. So in some of the polling data, we've seen different demographics of groups that are more or less interested in the vaccine, and different people who are able to get the vaccine, which is something that we're hoping to get into more with this discussion, both in terms of what are people afraid of, or people who do want to get the vaccine but don't have access. And Dan, if you can show those graphs. Oh, okay. Yeah, and so there's been polling with a lot of different groups trying to identify why different groups might not want to get the vaccine or might want to get the vaccine, and thinking about where people stand with that in terms of if they want to get it but don't have access, if they're waiting and not sure, or if they're very against it in some ways. So we'll talk more about that. The good thing, though, overall, if you go back one, Dan, is that we've seen more enthusiasm over time. So if you look at this graph, going from December up to March, we can see that more and more people have gotten the vaccine, and an increase overall of more people kind of falling in this group to get it as soon as possible. And now that it's available for many groups now, hopefully we'll continue to see a trend of people wanting the vaccine. And so one thing that is different about vaccination versus other kind of medical intervention is that how well it works. We can think about it in two ways. One is how well the vaccine works itself for you if you're exposed. We tend to think about that in terms of efficacy. The numbers from the trials have been really good. The other way of thinking about it is how effective it is in the real world. So the CDC is doing studies on this now, and it looks actually really good. And the one thing, though, is that part of how effective we'll see the vaccines work, it depends on how many people actually get them. And so vaccines kind of differ from some forms of healthcare in that they are primarily preventative, and it's a whole group effort. And so with that, I think we'll get into our first question. So with that in mind, thinking about the sort of public health aspect of this and the community effort, I want to ask Alan Stanton and Dr. Prickly Patton, if she's been able to join, about how do you see this fitting in with community and religious efforts aimed at improving public health?
Dr. Bertley Patton, do you want to go first?
Sure, why not? Well, prevention certainly fits smack dab in the center of where our community efforts are. And more so than ever, our community partners have been focusing on prevention, not just around COVID vaccinations, but around other health behaviors like physical activity, healthy eating, and reducing stress, along with addressing mental health issues. But our partners are really trying to express to their community members in our churches that we work with their church members, and even for the community members that they serve through their outreach ministries, the importance of vaccination, and really stressing all of the benefits that can be brought about through vaccination. And the other thing that I would say too, as it relates to prevention, we've seen more and more of our churches and of our mosques developing health ministries to begin not only addressing COVID-19, but also preparing for the next wave of, whatever's going to hit next, whether it's another pandemic or whatever the next health crisis may be. And in doing so, they're trying to address some of those social determinants that really play into how COVID-19 and other health disparities affect underserved communities. So addressing things like access and holding vaccination events at their churches and at their mosques, and really trying to push out accurate information so that their members can make informed decisions about their health. Really stressing the need for vaccination, but understanding that people really need to be able to make that personal decision for themselves. And then lastly, I want to add to that, with this pandemic, our faith-based partners have really seen the need to link their members and the community members that they serve with other community resources. Never before have we seen so many churches, so many mosques providing food, providing linkage to housing assistance services, trying to address employment, trying to get people masks and other PPE types of equipment, along with trying to just connect them to each other to address some of the stressors and mental health issues that have been brought about by this pandemic.
Yeah, I would echo a lot of that. Sorry.
Oh, sorry. I was just going to jump in because I forgot. I got so excited that I forgot to give you guys introductions. And so obviously you can tell Dr. Prickly Patton knows her stuff. She's a professor at the University of Missouri, Kansas City, and director of the UMKC Community Health Research Group and the Health Equity Institute. And we'll hear more about her work. And Reverend Alan Stanton is the executive director of the Turner Center at the Martin Methodist College, working with faith-based communities to lead economic development and expand access to healthcare and education. So just to give some context.
Yeah, thanks. So I would echo a lot of what Dr. Berkeley Patton said. In rural communities in particular, from a purely sociological standpoint, what we find is that rural churches are some of the only permanent stakeholders, permanent institutions in our community. So, colleges come and go. Hospitals, certainly in rural America right now, are going and forthcoming. So when we have those permanent spaces all throughout, like the more remote parts of the community, and these spaces are trusted, like they're some of the rare institutions that are still trusted, largely because they're smaller institutions, they're relational. And so we can actually leverage that to do a lot of development across the board. So in this in particular, what we're finding is that we can share information about the vaccine and information about preventative care more broadly in a way that's less politicized, less going to be focused on, it's not going to be as taken as warily, because it's coming from people and trust and live and work with on a regular basis. And then the other thing is, when we do any sort of preventative care, the reality is that these are places that are in the remote parts of the county that people can gather at. So they have that space where we're able to use that to reach the broader audience as well. So it fits right in with all the kind of other efforts in preventative care that we've been working on.
Thank you for that. Well, that is a perfect segue into our next speaker that we'll bring on here, Mayor Turgeon of Jefferson City. Real quick, Mayor Turgeon, I'll let you tackle your own introduction. If you could give us a brief bio, tell us where you are right now and how you got there, perhaps.
Well, thank you. I am Carrie Turgeon, the mayor of Jefferson City, and I was elected in 2015 to be the second woman to lead the capital city. Before that, I served as a city councilwoman for 6 years. I went to Missouri State University, so I'm a proud Bear, and I am coming at you from the mayor's office here at City Hall. And of course, the pandemic has been a big focus for the last year from my office, and so I'm really excited to get a chance to share with you today.
Thank you. Well, we are thrilled to have you, and I think I heard from both of our first answers here the importance of having sort of trusted messengers connected to the community. And you certainly fit that role. So with that in mind, I wanted to ask you, right now, we know that about 35% of Cole County residents have gotten at least one vaccine dose. For those folks in the community who have not yet been vaccinated, what are you telling them? How can they seek out a vaccine and start that process? And also, while you gather an answer there, I know at least I'm getting some audio feedback on my end, so if it's possible to mute mics while we have a speaker going, maybe that'll cut down a little bit. But yeah, Mayor Turgeon.
Sure, thank you. And while Cole County is around the 35% mark, we also realize that it may be higher because some of those have not been reported, because when people are getting those either at big box stores or pharmacies, they may not necessarily be reporting those to the state. So it's a little bit different, the reporting. And I think that that's what's been a challenge this whole pandemic, is comparing apples to apples with information and percentages. So it would be nice to know what that real percent is, but we feel like it may be a little bit more than that, hopefully. But here in Cole County, how we have really try to get people to encourage to get vaccinated is we have a site at the Capitol Mall. So we literally found the most convenient place that people can go. It's right on the bus line. So the bus literally is in front of the vaccination site. You have just a few feet to go to get in the door. So we've made it really easy. We just happened to have a space that was available. So we rented the space, have leased it for a few months through our county, because here in Jefferson City, the Cole County Health Department is over all of these type of decisions. So we've made it simple, but we've also found that I guess the demand is declining like it is everywhere. So what can we do to encourage people? So what we have done in Cole County is we've had weekly meetings virtually with the city, with our county, with the president of our local hospitals, SSM Health and Capital Region Hospital, Community Health Center and Cole County Health Department, and even our ambulance, EMS and fire chief join us, and along with our city administrator. We've been meeting every week virtually for months. And so we have that communication, we can adapt, we can get the word out. And then following that, we do that every Monday morning. And then every Thursday that week, we have a press briefing through Zoom virtually. We actually use the WebEx platform, but that allows us that every time we have weekly information and updates, whether it's about the vaccine and the center and how, the hours of operation and whatever we need people to know, we know now that every Thursday, the press has an opportunity to listen into our announcements. And these are, 15-minute press conferences. They're easy. But we found that a constant communication and reliable communication from trusted sources is very, very helpful. So I think that has helped us to be successful. But then I also think that being good examples, for example, when I received the vaccine myself, I made sure that I put that out on social media. I received my second vaccine now 3 weeks ago. So now my goal is to tell my story, because we found that some people may say, well, I've heard that people get sick after the vaccine, so for that reason, they don't want it. So as a mayor and a leader of a capital city, my goal would be to share my story and say, yes, I had both vaccines. Yes, I did not feel good the day after the second vaccine. But by that next day, I was out riding my bike and I rode a 10-mile community bike ride. So even though you may not feel good for a day and you may feel like you are down, you expect it, you know what symptoms to expect. And then believe me, you're up and running in no time. And so I think we need to encourage people, that those of us that have gone through it, how it is workable and manageable. So those are some things we've done. And then we can talk about a little later too, but I do feel like some incentives need to be offered, things like wellness points through employers and insurance, and things where, if people get enough wellness points that they get a discount on their insurance, it may entice them to do that. So who would think we actually have to entice people to do it? But I think that may be what it takes. And so I think we need to look at what might appeal to people in order to get it.
Okay. Well, that's a very complete answer, I feel like. We have one more panelist that I want to introduce here, Megan Simmons, who is the Senior Research Strategist at the Missouri Foundation for Health, which is an independent and philanthropic organization working with communities to build a more equitable future through collaboration, knowledge sharing, and strategic investment. She has a PhD in health behavior from Indiana and a master's in public health from University of Missouri Columbia. So welcome. And getting into the next topics here, we are interested if you could talk to us a little bit about the data you've collected from the role of community leaders in building vaccine trust.
Yeah, thank you for having me today. I really appreciate being invited to join. So I served in my role as Senior Research Strategist here at Missouri Foundation for Health. I served as lead on our focus group research project that really wanted to understand what the community response was to COVID, what perceptions of the vaccine were out there, factors influencing people's interest in getting them or hesitance. And when we were thinking about this research, we really wanted to reach out to communities that we thought might be left behind in this. So we reached out to Black and Hispanic communities across the state. We reached out to rural communities, and we reached out to conservative adults, so that we could understand kind of where that skepticism, where those perceptions are coming from. And one of the things that was identified, so I should say, we collected this data at the end of 2020 and the beginning of 2021. So most of our data was collected right as vaccination was starting to happen. So I want to put that caveat out there, because obviously a lot has changed in the environment. But one of the things that we saw at the time is when we were asking people about who those trusted messengers are, who they wanted to hear information from, so there was a lot of mistrust of government at the time, and that came from across the spectrum. And so people were really looking to folks that they had identified as, leaders in their communities, people who really were deeply ingrained in their communities, people who reflected their demographics and also their values. And what we found was that Depending on people's engagement in religious activities or people's engagement in civic activities, we really found that the trusted messengers were tied to those activities. So for people who attend church regularly, pastors, reverends, really church members even were considered to be those trusted messengers. For people who weren't necessarily engaged in that showed up in other forms, right? It was, are you regularly liaising with community organizations that you feel really, really close to, that you feel represent your interests? So I think there really is a great role for community leaders in the messaging, but also in helping to identify where you can position vaccine sites to make them most accessible to their communities.
Yeah, thank you so much for that, Dr. Simmons. I'm going to take a brief second here and remind anyone watching that if you have questions for our panelists, to drop those in the chat function of whatever platform you're using to watch. We'll have Dan pop in here and there to make sure your questions get heard. I want to circle back to Reverend Stanton. So first of all, now that we've got everyone on board here and we've given people some time to tune in, I believe you have a book coming out at some point, so I'm going to insist that you make a plug for yourself at some point here. But my substantive question is, so we've heard a lot about this sort of trusted messenger perspective. You've been doing work through your own organizations to make vaccines more accessible, spread accurate information about vaccinations. Can you tell us a little bit about those efforts as maybe sort of a model for rural vaccine outreach, and also describe, I guess, any barriers that you've encountered in that work?
I'll start with the barriers because that's a really great question, and that kind of shapes how we respond to what we're doing or shape our responses. So we have data that tells us that the people in our community who are least likely to get the vaccine are people who are of a political persuasion or particular political persuasion. The African American community is less likely to get it. Young adults for a variety of reasons, which we can access pretty easily in the community here. And then people who are below the poverty line. And there are different reasons why all of those demographics are going to get it or not wanting to get it. But we also know that, so that's a messaging issue, right? We have to figure out how to respond to the vaccine, how to talk about literacy for the community. So here on campus, for instance, we spend a lot of time talking to young adults who are really, really afraid that if they get the vaccine, it'll cause infertility. That's a persistent rumor that is all around our campus. And we spend a lot of time talking to them about well, no, there's no, that's not in the cards. That's not the data, right? But then there's some infrastructure problems that we have. So one of the things that really pops up a lot is that a lot of the senior citizens who are not registering for the vaccine, who have been eligible for some time, they just can't navigate the registration platforms. They're really technocentric. They're a little bit complicated. They require broadband, which not every part of our county has broadband. So if you're in town here, you have access to fiber. If you get about 5 minutes outside of town, about 2-3 miles, then you no longer have access to reliable internet. And so trying to find ways to register people outside of that has been really difficult. And then some people just can't get off of work to go to the central vaccine site on a weekday when the vaccines are offered. So we have, in our community, for instance, we have a lot of people who work these 12-hour shifts in factories, right? They can't take a break randomly at 3 o'clock in the afternoon to go get the vaccine. So what we've been doing is sort of a three-pronged approach to this. So one is just vaccine literacy, spreading information. And we've been doing that through churches, through newspapers, through civic organizations, really trying to get out clear messaging about the safety and efficacy of the vaccine and why they need to get it. And we do a lot of appealing to emotions, right? So we'll tell stories about someone who got the vaccine because their father passed away and they really care about the community or they want to help their family, those kind of things. We spend a lot of time listening to the very particular fears in our community to try to respond directly to those and do so in a way that's not condescending. So when college students come up to us and say, if I get this, am I gonna, not be able to have children? And have a conversation about something that they're actually very afraid of in a way that isn't gonna make them feel stupid and make them feel heard. We spend a lot of time working on actually registering people. So we do things like when we have a food drive, for instance, and people can come get their bags of food for the week. we're out there with like iPads, right? We can go register people there. We do things on the campus greens to register people in churches. We have advocates that are in churches helping to register senior citizens in their communities. And then we are also offering vaccine hubs at congregations and factories in the community. So we're doing our first one in next week, actually, next Saturday, out in one of the more remote parts of the county, targeting people who live out that way. We'll be doing one. Hopefully, we're trying to plan a date to do one in the one of our major factories down here, so that people can get it in their workday or as their shift is ending on their way out. So just trying to make it like remove all these barriers to get it and make it like a default choice. I'll also say that one of the barriers was, as we launched this, your vaccine is safe literacy drive. That was about the time the Johnson & Johnson vaccine news came out. And so that was a really hard week for us, because we had been touting the Johnson & Johnson vaccine, and it didn't change the reality that the vaccine is safe, but it did change how we had to communicate that. So it's a slog, but it's, I think, a really important one. So we're really proud of it, and we're really hopeful to see some positive growth.
Hey everyone, I'm back because we have our first viewer question. This one's from Jody Jackson, viewer on Facebook, and I think this one's for Mayor Turgeon, or really anybody who wants to pop in and answer this. Does anybody want to respond to the concept of COVID fatigue regarding the news briefing every Thursday? Has the media maintained interest and attending or reporting on your briefings? For everyone just wondering if COVID information overload and overall COVID fatigue figures into vaccine hesitancy. Are people sick of hearing about COVID? Are they just ready to move on?
Well, absolutely they are. And I know, since that was directed as a mayor and as of having these weekly press briefings, I think the key is to have people that your community wants to listen to and hear from, having trusted hospital leaders and the doctors that everybody knows. And you know who that is, whether it's on your campus or within your workplace or your community. You know who people want to listen to and hear from, because I think while there is that kind of fatigue and we're tired of hearing of it, so quit giving us that information, there's also we want to hear real information. We want to hear true information. So on our last one, we actually had a doctor that talked about his specialty was fertility. So he was able to address that specific piece. So what we do is we make sure we're relevant, and we make sure we cover the topics that our community wants to hear. And it's actually been very successful. And also the consistency in communication. And I think while there is an overload of information out there, people look to us. They look to their mayor that they trust that's out there in the community. They look at some of our local docs that everybody knows their name and everybody knows who to look to. So I encourage you to find those trusted individuals, your pastors, your teachers that everybody really knows, some university leadership, so that when you talk, they actually are listening and you are giving them real and relevant information, not rumors, because people can't distinguish that. But when they hear us, they know it is the real information and it is the experts talking to them. So building trust, though, you got to have the trust first.
Great answer. So I kind of want to get back to the idea of the sort of central location, particularly churches, I think are interesting because, no matter what community we're in, there's likely going to be a church around. And so I was kind of interested in the work in churches in terms of vaccine distribution and sort of how that connects with sort of the mission overall.
Before you answer that, we just had a question come in that raises the same question. I'll put this up on the screen from Britley Whitley from YouTube. How else are religious and community organizations helping with some of these structural problems that have limit vaccine access? How can state and local governments support these? And I think that really mirrors closely the question you were asking, Dr. Bratward. And I'll go.
Well, I'll jump in and attempt to answer that question. One thing that I know from the work that we've been doing with faith-based communities for over a decade, and we've done many studies about increasing various types of health screenings in the church setting. But what we know, if we don't know anything else, is that if the pastor promotes it, it will happen. And so the more that we can get more and more churches equipped, particularly the pastors, to talk about vaccinations, the more they can promote it accurately, the more we'll get more people vaccinated from those venues. And what we've also seen from our studies is that when there is increased communication between congregants about any particular health behavior, we also see that that contributes to an increased uptake, particularly around health screenings. And so if we can tap into that influence and the social networking that happens in faith-based institutions, that will greatly increase the reach of vaccinations. And then also even just more on activities that can happen in the church. For most of our studies, and what we've seen to be very effective is when we see pastors model receipt of whatever the health behavior may be. And in Kansas City, we have pastors modeling receipt of of getting their vaccinations, and as said by others, including the mayor, that they're sharing their stories. And not only sharing like all the positive things that they can do since they've been vaccinated, but also sharing some of the side effects that they've had from vaccination, so that they're being very transparent with their congregants and others that they have influence with on, what their particular experiences were. And then another thing that's been working really well in Kansas City is to have smaller vaccination events at even some of the smallest churches, where the members are signing up other members to get vaccinated and using things like their telephone tree messaging systems to, pretty much do a each one reach one to make sure that all are vaccinated, and not only for themselves individually or for their families, but even for the church body, because many of our churches in Kansas City still haven't gone back to meeting in person. And this brings up another barrier that I want to kind of piggyback on some of the barriers that were mentioned earlier, in that we really need to be able to increase the technology of our faith-based institutions. Many of our churches struggled initially in the pandemic to even have virtual services. And we know that services are some of the most impactful times where you can share health messages and to promote things like vaccinations. And so many of our churches had to struggle to understand, how do you do live streaming services? Many of them didn't have the technology or the internet services that they need in their churches. And so that's something we really have to keep on our radar screen, that if we want faith-based organizations to be a part of the solution, they really need to be equipped with all the tools, not just the information, but the technology tools and even communication approaches to sharing information.
I'll kind of piggyback on that to say, like, in where we live, in rural broadband's a major issue. And so in a lot of our communities, the only group or the only place that has access to reliable internet might be your local small membership church. And so we spend a lot of time in churches. Like at the beginning of COVID, a lot of our churches are opening up their parking lots, opening up municipal classrooms to allow students to do virtual school. And that was a major thing that churches were able to do for low cost to them. The two big things that, and like, I just really want to reemphasize what Dr. Berkeley Patton said, was that the churches are trusted, which is really rare for an institution these days. Like rural churches in particular are trusted institutions. Like, everybody, and your pastor, and you trust your pastor. So when you hear information in your church, whether it's good or bad, like you trust it. And so we really want it to be good information and like accurate information. But then in rural communities, to emphasize this again, there's some of those only permanent places. Like we don't have a ton of, like when you get outside of the town, you don't have like community gathering spots, or there's not like a lot of schools or anything like that. You have churches, and that space is an asset that we leverage a lot. So when we're looking at doing vaccine drives, we're looking to say, and this is true of any like community development initiative that we do, ranging from like health screenings to food distribution. Churches are kind of the place where people can gather, and they can gather there easily. And they're not as afraid to gather there. So, when we talk about mental health, for instance, people are less likely in a rural community to go to a therapist office because they're really worried about the stigma of mental health. But in a rural community, like you'll go to your church, right? So we can set up access to like mental health care in rural churches. So the same is kind of true of COVID, where if we can get people to go to this central location that is in their place that they already trust going to, then it's a win for the community. So we like to leverage that asset.
And I just want to make one other point too, as an asset of the churches, is that what we have found is in Kansas City, most of our churches have some type of outreach ministry, whether that's food, whether that's clothing, whether that's recovery programs, and the list goes on and on. And they are in a really unique position to be able to reach some of the most underserved people in their community, from the homeless to people who are in transitional housing, to people who maybe they're in an acute situation where, a month ago they were fine and today they're not. And so our churches are really playing a role in filling that gap, where people know they can go there and get linked to many different community resources that they otherwise wouldn't know where to go to.
Well, thank you for that. I'm excited to hear that this discussion is circling around the topic of stigma. I think that's something we're going to ask about in a second here. Maybe it's an under-discussed barrier that I think deserves to have some light shown on it. One thing I wanted to ask before that, though, so I'm hearing a lot of sort of lessons learned here of practical things that maybe in the rush to get all this infrastructure set up, there's some things that kind of drag behind, whether it's like Reverend Stan is saying, we just don't have the broadband access, or people aren't super tech savvy and able to navigate through these platforms, or work schedules, or the vaccine site is too far away. So these are all really good practical lessons that I feel like we've learned, and it's clearly important because, as we said at the top of the show, this is not a complete process yet. We're still sort of right in the middle of it. One thing I'm curious about as we switch into thinking about some of the more messaging forward and sort of information dissemination aspects of the vaccination drive, I'm curious if we have sort of similar lessons learned around the messaging front. Dr. Simmons, I know your organization, like you said, has been collecting data on this, and I'm sure you've been following other organizations thinking about this problem. Do you have a perspective on the sort of lessons learned in the information dissemination side of things that maybe we weren't taking into account in January, but now that things are really up and running, that are top of mind, or maybe should be top of mind?
Yeah, so I actually think that one of the things that we can highlight with this process is that there are some underlying lessons learned that have applied this entire time, and maybe we are just doing a better job of thinking of them now. And that really comes back to the idea of having accessible information and also accessible sites, right? So it's all about accessibility. But when we think about what accessibility looks like, I think we're starting to collectively be more creative about what counts as accessibility, right? So as Reverend Stanton was saying, talking about safe spaces for accessing vaccination, or trusted spaces, as Dr. Berkeley Patton said, about who is providing the information. I think the other piece of this is, making sure that the modalities through which you're getting information out is going to be incredibly important. So recognizing that some people don't have internet access, recognizing that there aren't many television shows or channels available in Spanish language across the state. So making sure that you're getting language-specific messaging out. What else? I feel like there are so many. Yeah, and I guess the other part is making sure that it's culturally appropriate, right? Is that it's not just messaging in specific language, but making sure that the messages that you're sharing are really valued by the communities. So, one of the tactics that we have taken as an organization is we know that we are not the people who deem things to be trustworthy evidence, right? Like, that's not our role. But we do know that there are certain trusted messengers out there. We do know that there are certain places where that evidence is available. And so our role as communicators has been to really highlight what it is that people are concerned about, and highlight the potential benefits of vaccination that are important to communities, right? It's not just what I think is important, it's that you have to identify what communities find the benefit of. And I know we're going to get to this later, but just thinking about, you know, if you're going to be encouraging people to seek out information, it really has to be with an understanding that they will be making their own informed decision. And our role as communicators is to help them find that evidence-based information, not to make the decision for them.
I think that's such a good point, and one that I've seen kind of coming up over and over again is, you know, ultimately people get to make their own decisions, and you know, people should have the best information available to them to make those decisions. And along those lines, I want to sort of ask a question about empathy, and I'll direct this towards Dr. Berkeley-Patton, because of your previous work. My understanding is that it was with HIV in the churches. And, you know, that's another pandemic that is extremely polarized and, you know, has a lot of elements of shame that people might feel associated with it. And so I'm wondering, you know, based on your experiences with that, how should we be thinking about having more empathy for people and discussing vaccination and other preventative measures without passing judgment? Oh, you're muted.
You're right, Jenny. No other disease in our lifetime has been more stigmatizing than HIV. We also know there's a long history of stigma around mental health issues. And now with COVID, I mean, we've all heard stories about, you know, stigma-related incidences with people who have contracted COVID-19, especially much earlier in the pandemic. But in our work with HIV, as it relates to stigma, one of the first and foremost things that we always try to do is to educate with consistent messaging. Most times people are afraid of things that they don't understand. And when people don't understand something, that's when the myths just flourish. And we saw that with COVID-19, where we heard everything from, if you get tested or if you get the vaccine, you're going to get a microchip implanted in you. And even in the African-American community, you know, there was this myth that, you know, Blacks can't contract it because there's something in our African blood and lineage that won't let us get affected by, you know, by this virus. And the myths could go on and on and on. And so it's really key to educate people with consistent messages so that they can begin to build a swell of knowledge around this particular issue. And then the other thing that we know from HIV is that we have to really begin to normalize what disease looks like. And for COVID-19, that again goes back to what many others have said in having people who have lived with COVID-19 share their stories, share their experiences, so that, and share their who they're in relationships with, so that people can realize that can be my mother, that could be my brother, that could be my, you know, next door neighbor. And that begins to more so personalize what people's experiences can look like. And then we need to be able to tap into compassion. And this is where our influential leaders really need to stress having compassion, living for people living with this disease, and to stop people making people feel guilty, which is what we heard a lot of early in the pandemic from people who were living with COVID-19, that, you know, people were making them feel guilty, like they went out and did something to purposely get COVID-19, where, you know, for the most part, many times people didn't even know where they had contracted it. And then one last thing too around stigma is we have to begin to address the stigma that's even being perpetuated in our healthcare environments. We saw that with HIV. Even with COVID-19, we've heard many, many stories of people who went to the hospital, they weren't listened to, they weren't respected, their concerns about their symptoms weren't respected, and they were sent home and then had horrible outcomes because of that. We've heard many stories of people who were in the hospital and how they felt like they weren't listened to or were just disrespected. And so we know that there's a lot of work that has to be done around racism, discrimination, and stigmatizing beliefs in our healthcare systems as well.
Yeah, I think it's really important to raise those points of how deeply personal both dealing with the actual pandemic itself has been, but then how personal a decision of something like vaccination can be. One potential difficulty in thinking about vaccination campaigns is that people do bring all their sort of pre-existing beliefs and values and experiences into this situation. And so one question I want to ask of Mayor Turgeon, and this is sometimes a tricky question because, again, it does seem personal and it you know, we don't want to overgeneralize, but one thing that we've seen is that along the lines of something Reverend Stanton mentioned at the very beginning here is that political beliefs do seem to be a pretty not a terrible predictor of people's willingness to get vaccinated. In particular, I think we have evidence now that folks that lean conservative or identify as Republican are, on the whole, less likely than self-identified independents or Democrats to be really seeking out vaccination actively. I'm wondering, in your role as a political figure, how you think about that situation, how you talk to people about those beliefs, and what kind of concerns you might have around those attitudes.
Absolutely. That's a great topic and a touchy topic. I'm getting a little bit of feedback on my end, so I hope you can hear me all right. But I do face that. And of course, being in the capital city, we are a very political city. But the interesting kind of ironic thing is we are a nonpartisan city government. So all of us, including myself, all of our city council members and the mayor, we are not a declared party. So we run just on our own. And but interestingly, I am a Republican, but I am extremely adamant about getting the communication out and being a good example about getting the vaccine. So I think that the best way that we've been able to handle that here in the capital city, just being a naturally political town with a very nonpartisan city government, is that we have formed partnerships. So we work very closely with the city and the county and the state and all of our leadership together. We've had a lot of discussions. The governor has met with mayors and had a lot of Zoom or internet and conference calls with mayors throughout the pandemic. So we've been able to keep the communication open, share our concerns. But I think really being able to lead from a place where I don't bring up party, I don't bring up politics. I have posted and shared on social media on a very consistent basis, especially early on in the pandemic, a lot of messaging that got out, but you will find that there was never anything political in any of my messaging. So I think being very careful. Now, people may naturally take that and make it political on their own, but if you really do lead from a place where you leave that out of it, it's actually very easy to do. And I think it is unfortunate that it has become political, but it only becomes political if we allow it to be. And if we don't, and we just lead from a place of kindness and empathy and understanding and just getting trusted leaders and building these relationships, then you will find that you will be able to lead. And working with our church leaderships and working with, for example, we had NAACP, we've had some nurse organizations. I mean, you name it, we have really come together and we trust each other and we work together. But leaving the politics out of it is easy. And unfortunately, people don't, but we have to make an effort. Being the top elected official in the city, I wished that I had it even at a higher level. But when I found that it didn't seem to exist, or it was more, more adversarial, that at the local level, at least we were able to say, hey, we understand the fear. And another interesting thing, bottom line, this is going through a disaster like everything else. If you look at the dynamics of a disaster, we had a tornado in 2019. So I can tell you go through that kind of. In the beginning, everybody wants to help each other and everybody's willing to get groceries and drop them off at your doorstep. And then you get that fatigue that sets in like any disaster. And then people get angry and mad. And then you have the mental health aspect of it as well. So we've been through that disaster before. And I watched it happen again, this time with the pandemic. So I think understanding all of those steps and what we can do to work together and be understanding as leaders and keep politics completely out of it, you can really find success. And there's politics in other organizations too, not just in government. So sometimes in workplaces or other groups or things that you may be involved in, you find that kind of politics exist naturally. But I think you find a way to work around it. Don't ever let it get you down, and don't ever, be on the offense or on the defense. You really should always be proactive as a leader and be that good example, and tune it out when the politics comes in, but find a way to focus on your goal, which is having a healthy community. And if you can always communicate that, then politics should not get in the way.
Thank you for that very thoughtful answer. Very interesting to compare it to sort of the most recent previous disaster you're facing, and what a challenge that can be regardless of what disaster it is. I'm going to take the conversation back to something that we briefly touched on and want to make sure that we cover, because it's been in the news a lot, the Johnson & Johnson vaccine, which had been briefly paused as researchers assess data on potential side effects. And I want to ask this to Megan to ask, now the pause has been lifted, with just people should know that there's this rare risk of blood clotting. How do you think that's shaped the public confidence, and how should we be thinking about talking about the risk and benefits of the different vaccines?
Yeah, thank you. So with the caveat that obviously our research was done before the Johnson & Johnson vaccine was available, so I can't speak directly to this impact, but I can definitely tie it back to what we found when people were talking about their fears of this is that when people are thinking, at least the people in our focus groups were thinking about the risks and benefits, the risks were these very kind of concrete issues, right? The risks of severe side effects, the risk of it not being effective against new viral strains, the risks that they're going to have to keep getting it every year, right? These are things that were really concerning to people. But on the other side, the benefits were these kind of broad, philosophical, and really consistent messaging, which was just that people want to get back to normal, and normal means different things for different people. But what we heard about the benefits was that people were really interested in, being able to go back to church, being able to hug their loved ones, or go to travel, or, see their coworkers again. It's really about these kind of getting back to being interpersonal. And so I think when you think about some of the news that's come out with blood clot risk and things like that, I imagine that for people who are concerned about severe side effects, this probably does impact their kind of level of assurance around vaccines. I think it does come back to that consistent messaging piece, which is what do we know and what is consistent about vaccination. And we know that getting any vaccine probably comes with some small side effects, right? We know that it's an incredibly effective way and one of many ways that you can prevent COVID, and you can prevent severe side effects of COVID. So I think it's, knowing that the evidence will continue to change, we'll continue getting new information, because that's how science works, and how time works, that being able to focus on those very consistent messages and those very consistent benefits of, like, this is one of the things that you can do to protect yourself, your family, your community.
Thanks. Yeah, I hear that as an optimistic note, honestly, that we've obviously had a difficult time for the past year, but we've learned a lot of lessons, and now is sort of our opportunity to bring those all to bear as we start to hopefully wind down some of the worst of this pandemic. I think that is a good segue for us as we wrap up in the last 5 minutes or so here, to think about things a little bit optimistically, and on a bright note, perhaps. Megan, I know following MFH's work, I've seen a lot of this sort of discussion of return to normal, and that being a really important factor in people's decision around getting vaccinated. I think we can kind of model some of that behavior here for our viewers. I want to ask everyone, what are you excited about in terms of returning to normal? What does that look like to you? How, will you know that sort of your community is back on track and that we have made some progress in getting past the worst of this pandemic?
I'll start. For me personally, I think this is both like a community question and a personal question, right? Knowing that back to normal looks different for everyone. For me, one of the things is that my parents live overseas and I have not been able to see them. I am really looking forward to a day when I don't have to fear getting on an airplane or being in very crowded spaces. I think from a community perspective, there is, thinking about the mental health impacts of isolation. We're starting to see that as more people get vaccinated, there's more opportunity and more safety around seeing other people. And so I think we're going to start seeing people in the community again. I think we're going to have more opportunities to socialize safely. And I think that's also part of the consistent messaging, right, is that vaccination is one piece of the puzzle, but it's not the entire puzzle. So I think it's going to be a balance moving forward, but I definitely see optimism in the community in terms of people being ready and excited and feeling empowered to get back to those like deep interpersonal connections.
I'll go next. For me, getting back to normal will mean getting rid of some of that daily angst that comes about from living during this period. Even when you go to the grocery store, and I don't know about you guys, but if someone starts getting a little bit too close to me, like there's this inner kind of panic button that starts going off. And I've been fully vaccinated. And so I was even questioning that with myself the other day. Why are you still feeling anxious about this? But it's been so much of our experience for the last year that, back to normal for me will be feeling like you can go out in public and not having that little thing in the back of your head or in your chest, worrying about how safe is this particular environment.
And I think as a leader of a community, not feeling like we have to tell people what to do, that seems like that's been the leadership role for the last year. But instead, we can show people why this is so great to get the vaccine, make it simple for them. We won't solve the internet problem, but by gosh, they can come in and they can have walk-ins and we can make it as simple as possible for them. So they're really not having to have those regulations, but rather show that with the vaccine, here's all the great things we can do. Personally, I've loved getting back to yoga classes with a group. That's just been a personal thing. And I have family overseas I'd love to see as well.
We have a 3-year-old and a 6-month-old, and the 6-month-old obviously was born in the middle of all this. And so there's some things that like we just haven't been able to do as a family, and some of the same experiences that we wanted to have with our newborn, we haven't been able to have. And then there's just like, there's always kind of a lurking sense when you're a parent, like, am I making the right choice? And then you realize like there's no right choice. But that's been particularly hard during COVID, where you're just going like, oh gosh, there really is no right decision here. There's no like, it's just a bunch of bad decisions that I don't want to make. So I'm really looking forward to not having that feeling anymore.
I would say, I have a degree in public and global health, and I do have COVID fatigue. I am just sick of it. And I just can't wait for the day when I can just watch a football game with my friends and, and have a beer and just enjoy life. I hope that day is coming soon. And, I hope we're able to get there. We talked a little bit about social media earlier. I want to encourage everybody who's watching to go follow Mira Turgeon. She's a rock star social media expert. So go ahead and do that. I'm going to keep doing this until I regret it. But here I'm putting it in the comment section. Here is the link to our after party event. Everybody's welcome to come. You don't feel like you have to, but stop by and say hello. It's just a friendly conversation for everybody who's watching. and who maybe wants to say hello and meet everybody. But with that, thank you everybody for joining. Such great information today. Even just me sitting here, and I helped organize this. I got a lot out of it.
Yeah, thank you for having me.
Same. Thanks for having us.
This is great. Thank you.
Thanks. Hopefully we can do it again soon. I know next month we are going to talk about here in Missouri access to mental health, which if you are outside of maybe the Columbia area or Kansas City or St. Louis area, is kind of a bummer for you. So we're going to talk about that with Rosie Dutt from Washington University in St. Louis, and also helping us out with that will be Dr. Eleni Bickel from the Most Policy Initiative. So with that, thank you everybody. Hopefully we'll see you at the after party. If not, I know it's Friday. You got other stuff you want to do. We understand, but we'll be there. We'll stop by and say hello if you can. All right.
Thank you. I'm going to get a selfie with the mayor, so everybody smile.
Yeah, everybody smile. Cool. We made the mayor social media. Let's get on the Insta. Okay. All right, guys. Take care. See you later.